Understanding health insurance coverage in America. Decoding the American health insurance system, a comprehensive guide. Welcome to our video, Decoding the American Health Insurance System, a comprehensive guide. Today we'll uncover the complexities of the health insurance system in America. Section 1. Health Insurance Basics. Definition of health insurance, why it's necessary, and who the key players are. Let's start with the basics. What is health insurance, and why do we need it? Who are the key players involved? Types of health insurance in the U.S. private versus government. In America, we have two main types of health insurance, private and government-sponsored. Each has its own distinct features, benefits, and challenges. Section 2. Private insurance and government payers. Private insurance: who provides it, who it covers, its benefits and downsides. First, let's dive into private insurance. This type of insurance is offered through employers or other organizations, or you can purchase it on your own. Government payers include Medicare, Medicaid. Who qualifies for them? Now, let's talk about government-sponsored insurance, specifically Medicare and Medicaid. Both programs are designed to assist certain groups of people in obtaining health insurance. Medicare is a federal program that provides health coverage if you are 65 or older, or have a severe disability, no matter your income. If you or your spouse have worked full-time for 10 or more years over a lifetime, you are likely eligible to receive Medicare Part A for free. Medicare's 4 parts: A, B, C, and D. Medicare is divided into 4 parts, each covering different aspects of healthcare. Part A covers hospital insurance, Part B covers medical insurance, Part C, also known as Medicare Advantage, offers an alternative way to get your Medicare benefits, and Part D covers prescription drug costs. Who qualifies for Medicaid? Medicaid is a state and federal program that provides health coverage if you have a very low income. Medicaid programs must follow federal guidelines, but they vary somewhat from state to state. They cover low-income adults, some low-income children, pregnant women, elderly adults, and people with disabilities. How Medicaid works. Medicaid programs must cover certain populations and health services, such as hospital care and doctor visits. States have flexibility to cover additional populations and services. So, the eligibility rules, covered services, and costs may be different from state to state. Section 2.1. Managed Care Plan. Now, we'll shift our focus to a significant component of the U.S. health insurance landscape: managed care plans. These plans contract with healthcare providers and medical facilities to provide care for members at lower costs. Explanation of health maintenance organizations, HMOs, what they are, how they work, their benefits, and downsides. The first type of managed care plan we'll discuss is the Health Maintenance Organization, or HMO. HMOs have their own network of doctors, hospitals, and other healthcare providers who have agreed to accept payment at a certain level for any services they provide. Explanation of Preferred Provider Organizations, PPOs, what they are, how they work, their benefits, and downsides. PPO plans provide more flexibility when picking a doctor or hospital. They also feature a network of providers, but you can see out-of-network doctors without a referral. Section 3. Cost sharing and premiums. Defining key terms like co-insurance, deductible, and premiums. Co-insurance. This is the percentage of costs of a covered healthcare service you pay, 20%, for example, after you've paid your deductible. For instance, if your health insurance plan's allowed amount for an office visit is $100 and your coinsurance is 20%, after you've met your deductible, you'll pay $20 for the visit. The insurance company pays the rest. Deductible. This is the amount you pay for covered healthcare services before your insurance plan starts to pay. With a $2,000 deductible, for example, you pay the first $2,000 of covered services yourself. After you pay your deductible, you usually pay only a copayment or coinsurance for covered services. Copay. A copayment or copay is a fixed amount you pay for a covered healthcare service, usually when you receive the service. The amount can vary by the type of covered healthcare service. For instance, a doctor's office visit might have a copay of $30. Premiums. This is the amount you pay for your health insurance every month. In addition to your premium, you usually have to pay other costs for your health care, including a deductible, copayments, and coinsurance. If you have a marketplace health plan or other individually purchased insurance, you usually can't deduct your premium on your federal tax return. Explanation of how and why insurance premiums go up. You might have noticed that insurance premiums can rise. But why does that happen? Factors driving up insurance premiums. Several factors can cause insurance premiums to rise. One key factor is medical cost inflation, which includes the rising price of medical treatments, procedures, and prescription drugs. Another factor is an aging population, as older individuals typically require more medical care. Also, changes in healthcare regulations or insurance laws can impact the cost of providing insurance. The impact of lifestyle and health status on premiums. Your personal health status and lifestyle choices can also affect your premiums. For instance, smokers often pay more for health insurance than non-smokers. Similarly, if you have a chronic condition, you might face higher premiums. Section 4. Physician offices and hospitals payment. How physician offices and hospitals get paid through health insurance. Health insurance isn't just about the patient. It also plays a significant role in how physician offices and hospitals get their payment. Health insurance significantly affects the operations of physician practices. Firstly, insurance coverage largely determines a patient's ability to seek care, thereby influencing a physician's patient volume. Also, the type of insurance coverage affects reimbursement rates, shaping a physician's income and practice's financial stability. Additionally, some insurance plans require physicians to follow specific treatment protocols, impacting clinical decision-making. Contractual agreements between physicians and insurers. Doctors and insurance companies often enter into contracts that define payment terms. One is fee-for-service, where doctors are paid separately for each service they provide, encouraging more comprehensive care. Another is capitated payments, where physicians receive a fixed amount per patient, per period, promoting cost efficiency. These agreements can affect the financial aspects of the practice and the nature of care provided. The role of health insurance in hospital operations. Just like in physician practices, health insurance plays a significant role in hospitals. It determines reimbursement rates for various services and impacts hospital revenue. Insurance plans may also influence patient flow, as hospitals tend to see more patients who have insurance. Lastly, insurance can affect the types of services hospitals offer, as they may cater their offerings to those procedures and treatments with better reimbursement rates. Discussing contracts between physicians and insurance companies, fee-for-service, capitated payments. Doctors and insurance companies often enter into contracts that define how the doctors will be paid. The two main types are fee-for-service and capitated payments. Fee-for-service model for doctors. Under the fee-for-service model, healthcare providers are paid for each service they render, like tests, procedures, or other treatments. This model incentivizes physicians to provide more treatments because payment is dependent on the quantity of care rather than its quality. Capitated payments for doctors. In contrast, capitated payments are a fixed amount of money per patient, per unit of time, paid in advance to the physician for the delivery of healthcare services. The actual amount of money paid is determined by the average expected healthcare utilization of that patient. This model encourages cost efficiency but can potentially disincentivize providers from offering more comprehensive, costly care. How hospitals are paid by insurance payers. Hospital payment systems are often different from those of individual physicians. Hospitals are typically paid through a system known as diagnosis-related groups, DRGs. Under DRGs, hospitals are paid a fixed rate for inpatient stays based on the diagnosis. Another system is per diem, where hospitals get paid a fixed rate for each day a patient stays in the hospital. Contrast between physician and hospital payments. In summary, while individual physicians are typically paid based on the number or nature of services provided, fee-for-service, or a fixed amount per patient, capitation, hospitals are often paid based on the diagnosis or the length of the patient's stay. These differences in payment models influence healthcare delivery and financial stability for both physicians and hospitals. Section 5. Conclusion and Overview. To wrap up, let's quickly recap the main points about the American health insurance system. Now, we'd like to hear from you. What aspects of health insurance do you find the most confusing? What would you like us to cover in future videos? Please leave your comments in the comment section. Thank you for joining us today. If you found this video informative, please don't forget to like, share, and subscribe for more content like this. If you have any questions, feel free to reach out to us at info@YourMD.online. Until next time, stay informed and stay healthy.